It's hard to believe that 1 year has already passed since I became president of our college. Time seems to have gone so quickly, and yet when I reflect on the year, we have achieved so much thanks to the outstanding contributions of our fellows and members and college staff, who have all made such an impact in taking this college forward. When I took on the role of president in December last year, I set a strategic goal for our college to be the go-to Royal College, one that offers so much in terms of education, training, support and professional knowledge that it becomes a focal point of influence. The healthcare workforce is one of the most valuable assets of any nation, but many of us are working in environments where there are staffing shortages, ever-increasing workloads are becoming the norm, and doctors and nurses are reporting increasing levels of stress, fatigue, ill health and burnout. As a college, we've played an essential role in setting standards for examinations and assessments, delivering education, training and CPD opportunities, and providing mentorship and support for the profession. In all of these areas, we have excelled. But this college stands apart from the others. We are unique as the only UK Royal College that represents healthcare professionals working across medicine, surgery, dentistry, travel medicine and paediatric medicine. There's great strength in the diversity of our community and ensuring our collective voice is the loudest to be heard in speaking up for the whole profession. This year, we've completed work on our college positioning to ensure the profession and public have a clear understanding of who we are and what we stand for. Our members have been wonderful in coming forward to share their stories about what matters to them. The faces of our membership have become the faces of our college, bringing to life imagery across our website and communications. We've stood up tall and established ourselves as the college that is speaking up for the profession. As president, I've outlined 4 key areas of priority. These are workforce, well-being, inclusivity and engagement. We've set up working groups in each of these areas to ensure that we're actively addressing concerns and speaking up to ensure progress is made. In April, we formed an engagement team with a focus on getting out and about, connecting with people and raising the profile of our college through networks and personal contact. You can see some of the activities that we've been involved with here. As president, I've had the pleasure of engaging with colleagues and partners in the UK, Ireland, India, Sri Lanka and Dubai. Our workforce group has been actively working to influence policy and identify solutions to current workforce shortages. While most of this work has been concentrated on the UK, many of the problems and solutions are applicable across other nations. Again, some of the issues we've spoken out on in the past year are presented here, and you can see what great examples they are also of collaborative working. There have been many reports evidencing the impact of workforce shortages on the well-being of the profession. More than a quarter of doctors report being unable to cope with their workload on a weekly basis, while 1 in 8 have had to take leave of absence due to stress in the last year. I very much welcome the GMC report on caring for doctors, caring for patients, and we'll be trying to drive the implementation of its recommendations. It is absolutely essential that our profession is well cared for if we're going to provide quality care to our patients. Our wellbeing group has been actively working with others to identify areas where our college can promote positive action and learn from best practice to improve well-being. We've also been very active in speaking up on this issue, and some more examples of exactly what we've been doing are presented here. As the first female president of our college, I feel able to comment on the lack of diversity which I've experienced on boards and committees. This is something that needs to be addressed, and the Inclusivity Working Group We'll be updating our policies and also promoting inclusivity as a core value in organisations. We've already taken action in a number of areas, and again some examples of our activities are shown on the slide. During David Galloway's presidency, the college established itself as a leader in the area of global health, and this work has continued this year through the MTI scheme, the Livingston Fellowships, and support for international organisations such as COSEXA. We're also proud to have worked in partnership with the Scottish Government and University of Glasgow to establish the first dental school in Malawi, which received its first intake of students this year. Through our charitable Hope Foundation, we've also funded a range of projects at home, such as the Winter Night Shelter here in Glasgow, and internationally, such as the Diabetic Foot Management Training Programme in Malawi. We continue to work in partnership with Obesity Action Scotland to influence policy to tackle this major public health challenge. And OAS has successfully influenced policy in Scotland through its lobbying work and hosts and supports the Scottish Obesity Alliance to ensure a single collective voice for action on obesity. These are just some examples of the areas where we've spoken up for the profession in the last year. Through our leadership, partnerships and inspirational college community, we've already seen a shift in recognition and profile of our college. Evidence through increasing engagement on our website and social media channels, and awareness among political parties through media inquiries and partnership opportunities. As we now look to the year ahead, we will continue this work while also planning to further develop our role in the key areas of leadership and non-clinical skills development to ensure that we are the go-to Royal College for all those working and influencing healthcare. In closing, I would like to thank our College Council, Fellows and members for their ongoing commitment and contributions, and to our college staff for their unwavering support. A particular thanks also to my colleagues at Glasgow Royal Infirmary, without whose help I would be unable to fulfil this role.